what happens when you have a dorsiflexion restriction? What does that impact the kinetic chain? What happens? And we found a systematic review that was published in 2017. And what they say there is that if you have a restricted dorsiflexion range of motion, you have an abnormal landing mechanics because you have less knee flexion and less hip flexion when you land. And that's kind of obvious. If you don't have dorsiflexion, if your movement is restricted in the lower link of the chain, you can't move your tibia forward, so you're not going to do knee flexion. And if you can't do knee flexion, you're not going to do hip flexion as well. And they also found that when you have a dorsiflexion restriction, you have a landing with a higher ground reaction force. And that also makes sense because if you're not dissipating the load in form of movement, if you're not doing dorsiflexion, you're not doing knee flexion, you're not doing hip flexion, you're going to have a higher ground reaction force. And that force has to go somewhere. So where does that force go? You will go into your passive tissues, you will go into your tendons, you will go into your cartilage. So they suggest that the dorsiflexion restriction is an important factor that may cause injuries in your knee, in your hips, even up in the kinetic chain. So as soon as we saw that, we started paying more attention to the kinetic chain in terms of how dorsiflexion will interfere with everything else. So my key message here would be, if your patient has a history of ankle sprains, pay attention to their dorsiflexion. Pay attention to that. If they have a dorsiflexion restriction, even if they don't have a history of ankle sprain, assess their dorsiflexion range of motion, because if that's restricted, you're not going to have the normal mechanics that you would have before the injury. So one of the things that we saw was that if you have a restriction in dorsiflexion, your ankle plantar flexors are not going to be as effective at producing the eccentric contractions that they need to dissipate the load. So if you look into studies into the contribution of the different joints for force dissipation, you will see that approximately 40% of the force is dissipated at the ankle. So if 40% of the force should be dissipated down there, and because the ankle is stiff, it's not moving well, you have a restriction there, you have less dissipation at the ankle, somewhere over in the kinetic chain is going to have to do more work to dissipate that load.